So we will have another minute before we start because we don't want to start too early. Meanwhile, hi, Carolyn. How are you?
Good afternoon, Melis. How are you?
Very good, thank you. Are you joining in from home?
I am. I've actually been off sick the last 2 days, so I'm going to give you the best of my day
Energy
today.
left. Oh no, I didn't know that. Please
That's
feel
okay.
better.
I didn't want us to cancel this exciting webinar.
Yeah,
So
thank you. Thank
thank
you
you
so
for
much for your
inviting me.
time. Yes, there have been a lot of sign-ups for this, so I want to give it another maybe minute or two before we go live, if that's okay with you.
Yes, that sounds perfect. Thank you, Melis.
So just for a couple of notes. So we'll be recording this session for those of you who are joining, who've just joined, so that we can distribute further to the people who signed up for the events. This is a session done by Wellbeing. So Wellbeing will be holding a summit called Loop Summit. So the Loop Summit has been going on for a little over 6 years now. We've organized that 9 times in 3 different geographies. And Carolyn will be joining us in the UAE one next month. So before we do that, we usually have online sessions with our speakers. For those people who can't attend the real in-person events, and those are usually extremely popular. And I think this one has been one of those that has had the most registrations so far. So let's start, I would say, slowly. So Carolyn, first of all, welcome. It's such a big pleasure to have you here. So Carolyn is the CFO of SSMC. But before I give her, before I ask you more questions, Carolyn, maybe just a little bit about you, who you are, what you're interested in. So let's start with that and then take it forward.
Thank you, Melis. So good afternoon, everybody, and welcome to this exciting webinar. And thank you, Melis, again for inviting me. So I'm Carolyn. I'm the Chief Financial Officer for Sheikh Shahbout Medical City in Abu Dhabi. I am South African by birth, and I've been in the Middle East for the last 14 years, working in healthcare for the last 20 years, since my son was born. And I am passionate about well-being. I am a yoga instructor. I'm also a coach. And I am just really interested in how we can keep our staff healthy and well so that they can enjoy work and be better at work in the workplace. And it's just a passion of mine that flows over from my personal life into my work life. And I think that's something that is so important to be able to integrate.
Amazing. Like, we don't usually see a lot of CFOs who are interested in coaching or teaching yoga, to be honest with you. It's usually between you and me, since we don't have too many CFOs in the room. I can say that it's usually in the conversations of HR, it's, CFOs are the bad guys, sort of.
We still are.
we talk about your lots, saying, oh, our CFO didn't approve this and that. So can you tell me a little bit about, first of all, I'm super interested in how you got interested in well-being in the first place, personally. But then I want to also get into the fact why you're interested in well-being as a CFO.
Yeah, it's a great question, Melis. I think, how I got interested in well-being in the first place, I think it's been my lifestyle growing up in South Africa on a farm and right next to the beach. Our life was very much outdoors. So we were always outdoors. We were always busy, swimming and running around the farm and horse riding and dance. I did dance as a young girl. So I think it just carried over. It just carried on with me into my adult life. And I love the outdoors. I love nature. I love hiking. So that's still there. And if I want to do the things that I love, like hiking mountains, and I need to be fit and well, otherwise I can't do it. And as I get older, it's not so easy. It's not like you can just jump up in the morning when you're 21 and go, oh, I'm going to hike a mountain today. When you're in your 50s, it becomes a little bit more difficult. You actually have to have some base fitness to start with. So my goal is just to really, as I get older, to maintain my fitness and my well-being so I can still do the things that I love to do. And
We
then
just
that's
get,
my
by the way, we just get more enjoyable the older we get. We don't get older.
let's hope so.
I just wanted to clarify that before we go any further than that. But
But then
that's beautiful. Yeah.
if I move on to why I'm interested in being in
Yes.
well-being as a CFO, I think it really started in one of my previous organizations where I did become a champion for the finance department of health and
Oh.
well-being when I was not a CFO. I've always liked to expand what I do. Numbers can be tedious sometimes, so I try to expand my interests across the organization. And I was asked to be part of their first well-being initiative. And so that really got me interested. And also engagement in the workplace is we used to work with Gallup as a provider for a strengths finder and engagement in the in the workplace. And that just really got me so interested um, in how you can tie in how you work and how you can perform with how you are at home and in your private life and how you are when you're well and when you're engaged and when you're treated with respect and when you're acknowledged and recognized, and all of it just fits together. And it just made such an impression on me for many years that when I actually, one of my reasons for wanting to become a C-suite member is that you can then influence policy and you can influence culture and strategy from and I'm in a position to do that. And so that was the beauty of being able to be in a leadership role and bring my passion and what I believe in to the workplace. So, it's been many times it's been thought of as a soft issue. Health and well-being, I think, sometimes is seen by people as something fluffy and something that's not really necessary because it's just fun. But actually, I can tell you from running the health and well-being program in our organization, it's a lot of hard work. The outcome is fun and it looks fun, but it's a lot of work, hard work behind the scenes. But there's really been, over the last decade, there's been so many studies and so many research studies to show the health benefits of workplace well-being. And really, it shows up in so many areas like engagement and retention, even productivity, or especially productivity, actually. And so if you want to bring out the best in your employees, and if you want to attract top talent, then you really need to be focused on how you keep your staff healthy and well. And ultimately, I think it was Forbes study showed that in companies, portfolio companies that were recognized as award-winning for their approach in health and safety in the workplace, they actually outperformed their market competitors. And so there's so much data that supports it that it's hard to believe that it's not worth it. And it's hard to make the case that it's not worth it. And honestly, it's the right thing to do. It is the right thing to do to look after our team.
Perhaps the last one is the most important one of everything that you just said. You said so many things that I feel like, okay, so one takeaway from that, what I'm hearing is start early. So if you're in charge of well-being in your organization, if you're an HR professional listening to this, I'm sure you've heard of the concept of well-being ambassadors that Caroline just talked about. And we, like as Wellbees, when we work with organizations, we make sure that there are ambassador teams within organizations, just because of the same reason that Caroline mentioned it. Because if the responsibility is always on HR professionals, it's almost like, it's an HR thing to do, right? But like if you disperse it amongst teams, it becomes this like company-wide responsibility that everybody is running after. And like you started early, right? Like you weren't a CFO then when you were in Wellbeing Ambassador. So I would say like raise the next generation of CFOs starting today, like penetrating into every single department, I would say, to place your agents to take over the company. But yeah, so that's definitely one takeaway. The second one I'm really curious about, like, how did you get your hands on the Gallup report that your company was working with on? Did you want to see it, or Did HR like put you in touch with the results?
Yeah, so in our company, we used Gallup initially, not in the company I'm in now, not in SSMC. This was in a previous organization. We used Gallup for our engagement. We did the engagement survey with Gallup, and we did the strengths finders through Gallup as well. And so the engagement report was distributed. It was distributed down to all the teams. So all managers received their report for their department. So if you had more than 3 staff, you would get a report and you could see how your engagement was for your department. And so that was a really great way of making sure that the responsibility for health and well-being was sitting with all the leaders in the organization, not just with HR and not just with the C-suite, but actually with all leaders. And then within that, the teams as well, because you can offer only so much. If the teams don't interact with you, then that is on them. You know, you have to encourage and you have to provide the programs and the resources, but there's also an aspect of getting everybody involved. So you really need your leaders to be buying into it, and you really need your champs that are spread throughout the organization to be helping you to sell it and to promote it, and then also to bring the ideas back to you. So I think there's so many ways of doing it, but I think what you said, Milas, is critical, is that it can't be run by one person. I'm not running health and well-being on my own. I'm the executive sponsor, but I have a team, a council that are helping me. And with that council, we then have champs. So it's critical to get that buy-in across the organization for it to be successful.
You said again 2 things that made me really extremely excited because when you said like it was the entire report was shared with the entire company, I think that's so crucial and important. Sometimes we do these things like on well-being maybe, or like we get a feedback on the well-being program that we do. I think to share the results with everybody, like with every manager in the organization, is so crucial because like managers' well-being and the way managers act upon their teams makes a huge difference for employee well-being, right? Like we talked about this with you previously. So the influence of managers on their teams is on par with their partners, which is huge, right? So yeah, it's very, very big. I mean, it's bigger than their doctors or their psychiatrists or the psychologists' influence. So it's a huge influence. So I find that very crucial to include them into these different like decision-making processes. And you also mentioned something else, like in your existing company, you're the executive sponsor, but then there are so many other people in the council. So I find that very interesting, the way you set it up. That brings me to my next question. So how do you run employee well-being in your current organization at the moment?
That's a great question, and I'll just start off with, health and well-being isn't only run by the council. There are many aspects to health and well-being in an organization, in any organization. I think the culture that you develop in an organization either supports it or doesn't support it, and hopefully everybody who's on this call has an organization that does support health and well-being, because there's so many aspects. Our Health and Wellbeing Council really runs initiatives that support the health and well-being. But you also have to look at things like your compensation and benefits strategy, your staffing models. Do they support having the right resources in the right places at the right time so that you're alleviating some of the burden of overwork? You also need to look at your health insurance. Does your health insurance cover enough benefits to support your staff's health and well-being? So one of the things we did last year was we realized that, after the COVID pandemic, there was such a mental health crisis, and especially in healthcare workers. And so we increased our health cover to make sure that mental health was supported. Then, you also need to have a speak up culture, because if people feel that they can't speak up, and if there's a culture of bullying and intimidation, this has a huge impact on people's mental health and emotional health. And eventually that will impact their physical health. So really encouraging that speak up culture and making sure there are avenues and forums where people can speak up freely and not feel that there will be repercussions against them. I think this is critical. And, you know, when I think of culture as well, eliminating the gossip is also, you know, gossip does a huge amount of damage that can also lead to feelings of poor self-worth and poor mental health. So there's so many aspects that you need to consider when looking at well-being as a company. Well, for us, with regard to actual Health and Wellbeing Council, we set it up a year ago as a council where we invited council members. There's about 12 of us from different departments across the organization, making sure there's representation from those departments. And then we also sent out a notification for people to self-nominate as health and wellbeing champs. So we have the council, who are the core group. It's a small group. They make the decisions on what initiatives to run, on how to spend the budget, all of those things. And then the champs, there's more of them. We have about 30 at the moment. And they're sitting in the different departments as well. And really their goal is to help us run the initiatives. Once we've decided what to do, they will help us to actually do those activities. They'll also take that back to their staff and their departments, and they'll also bring forward ideas to the council and present it to the council to say, this is what we think we still need to do. And so it's been very much a learning curve for this year. It was the first year. We're a young organization. We're only 3 years old, and the hospital started right in January 2020, and the pandemic hit us in March 2020. So our focus was on getting through the pandemic. And really after that, in 2022, we were able to start the first Health and Wellbeing Council. And it was really necessary to support our staff after coming through such a difficult time. And I think one of the other things in terms of a hospital health and well-being is we are developing our occupational health policies, and we're currently in the process of developing an occupational health clinic for our employees. Now, I know that that's not possible when you're not a healthcare organization, so we do have a bit of an advantage, but it is possible to tie up with organizations to have that opportunity to have occupational health covered and have that facility available for your staff. So many different ways to support staff that are, I think all of them are necessary. I can't even say one is more important than the other. I think it all comes together almost as a strategy of how you look after people. And, you know, if I think about the Sustainable Development Goals, the United Nations Sustainable Development Goals, this whole piece is really fitting into the goals that are encompassed in the Sustainable Development Goals. So it's really critical going forward that all companies are looking at this.
So true. And you mentioned so many different things here. So you talked about a multi-layered approach, which is needed when you're trying to change an entire organization. So in all of the organizational behavior change models, we're seeing like this multi-layered approach. So I totally understand now what you talked about in the beginning of this call about having too much fun with well-being, right? That's what's seen, right? Like those initiatives that we run, like the challenges and maybe the odd yoga in an afternoon, maybe those are the ones that are seen, but there's so many other things that goes into the making of a well-being program, as you said. So like there's the you talked about, for example, the speak up culture. I like to call that psychological safety because and then like in the literature, when you talk about psychological safety, we talk about being able to speak up your mind without fearing the consequences. And we just recently concluded this research with PwC in 5 different regions. And that was the #1 thing that correlated with high employee well-being. Psychologically safe organizations get that right, you know, like as you said, like when the environment is right, you can build the entire building on that soil. And then you also talked about the way we work, right? Like there's this HR tech guy called Josh Bersin, and he's recently done a very interesting work with a healthcare company. I'll send it to you, Carolyn. They've basically done the following. They looked at this healthcare providers' data through AI, and they looked at when patients were coming in. So AI started predicting when patients would come in. And according to that, they changed the shifts. So instead of doing like 8-hour shifts, they started doing 4-hour shifts. And like nurses started picking them themselves. Like the way you talked about the way you plan the work in a well-being way totally reminded me of that. And I find that very interesting. There's so much more we can do there. You also talked about the burnout crisis. I mean, especially for healthcare workers who looked after everyone when like the world was falling apart. I think that was huge. So maybe before I jump to my final and probably the most interesting question for HRs about what to ask you, I can ask one more thing. You said like there was so much learning, you said, in the past year. I would ask, like, what's the top learning or the top failure you had? Because I believe in learning from failures. The top learning there that the people who are listening to us right now could not fall into the trap of?
Yeah, I think that is such a good question. And I think overall our program has been very successful. And yes, we have had fun. I can't deny that we've had fun, and we should have fun. We should always have fun at work. We spend so many hours at work. We need to have some fun. So we did have fun running some of these initiatives, or all of these initiatives that we've done actually. But I would say the biggest learning for me was creating that balance between fun and seriousness in running this program. Actually, it's a huge responsibility to run a health and well-being program at work, because there's a big risk if you fail. You've heard all the reasons that we should do it, and if it doesn't work, then there's a big risk to us, to our employees. You know, we have this duty of care to our employees. So I think the biggest learning for me was creating the structure and the discipline around how the council and the champs operate. In the beginning, we had, and it was wonderful, and it still is wonderful, such engagement from the council members and the champs. But what we didn't do well in the beginning was communication, and we didn't have a good structure. So we didn't have a cadence where we were meeting regularly, where we were disseminating the information to the champs. So the council and again, a few members in the council were kind of fully involved and doing everything, and not because we just, you know, we all have a day job. So what we do in the council and what the champs do is all volunteer work. It's all extra to the work they're already doing. And we're a very busy organization. So we kind of got lost in not communicating well. And we didn't have a regular cadence of meetings. So we ran like that for about 5 months. And then in January of this year, we said, right, this is not working well. We're still doing all our activities. Those were happening very well. But we weren't getting the buy-in, and we weren't getting the support that we needed. So some of us were really exhausted, but carrying on. But we realized that that's not going to be the way to run it in the future, because really, for it to be successful, as I said earlier, you need everybody's buy-in. You need people that are committed to this. And so we brought in a structure where we set our meetings for the year ahead, for both the council and for the champs. We got clearer on our program of what we wanted to do for the year and what were the most impactful things. And we brought that structure in, and we also then reassigned our council members and our champs. So the way we did that, we were so grateful to have all of them volunteering, but many of them found that they just didn't have the bandwidth, and that's okay. There's no judgment. That wasn't a problem. We just wanted people to be able to commit, and then once they'd committed, they had to give a certain amount of time, and they had to be involved in a certain number of duties. So making the expectation clearer helped us to get council members
very good.
that could take part in it. And if they couldn't, it was fine. We invited them to be champs, because the champs they didn't have to give as much time. And so we still wanted them to be part of that if they wanted to be. Some of them said, no, thank you, it's too much for me. And we were like, great, please, let's just see you at the activities.
Amazing.
So that worked really well. And we still, honestly, Melis, we have a long way to go. One of the next things that we're working on, and you mentioned it earlier, is really about sharing the results with the organization. We focused on launching the activities and changing our culture, and we've done a good job of that. What we don't have is a science-based approach, and we don't have the data to share on what these activities have achieved. And we really want a way to measure that. And that's why we've also partnered with Wellbeing, because you are going to be able to give us that data that we need to transmit back to not just the organization, but the leaders, you know, the C-suite, to say, this is what the program's done. So proving our point on some of these things. So I think that's our next step, is really being more science-based in our approach. And we are very fortunate to have Dr. Shamer as our chairman of the Health and Wellbeing Council, and also the lead in our occupational health. So this will help us to achieve that as well.
You said so many important things here, but I'll just like summarize it like this. So you were you had the right structure in place, but you improved on the continuous communication, meetings, and you clearly showed what the expectations are to get everybody aligned, I would say. And now your next step is to get an ROI and share the results with the rest of the organization. This is fantastic. So let's say in the last 4 minutes we have, I am an HR professional. I have zero budget right now for well-being. So I come to your, what do I do? Do I take an appointment from you? Do I like, I don't know, do I put together, you know, specific well-being budget? And then like, how do I convince you? Tell me.
It's a question filled with different possibilities. And honestly, it's going to depend on your CFO or your C-suite. I think I'll go back to the point that you probably are not going to have to just convince the CFO. You're probably going to have to convince the entire C-suite. But as we know, the CFO holds the purse strings. So you probably want to engage the CFO early to understand what your CFO is thinking, and are they a CFO that has any interest in this, no interest in this? How far do you have to convince them? And remember that CFOs are data and process driven. So, you know, they will want to see how the program's going to work, and they'll probably want details of the program structure, how it will be run, who's going to run it. And so I think showing that investing in the project will bring about not just the qualitative improvements. So we know about those. We know without doubt that it will bring changes to the work environment. It'll bring changes to engagement of the staff. It'll positively impact the organization from a qualitative point of view. And there's a lot of literature on that. But you need to be able to convince the CFO and the C-suite that it's also going to bring a positive benefit to the bottom line. And you are lucky, because there are so many studies out there that show that it can bring benefits to the bottom line. But have your data ready. Make sure you know what you're talking about. So I encourage you to research. You obviously, if it's new to your organization, you won't have the data that shows what it's done for your organization. But try to find similar size organizations and get data on those organizations, or similar industry organizations, and show good data. I think, you know, some of the things that we know that it can impact is it can help you to attract better talent if you are addressing health and well-being in the workplace. It can help you to retain talent. So your turnover rate of your staff, in theory, should go down unless there's other really critical things that are impacting that. And that's why I said earlier, health and well-being is a combination of things in your organization. So there might be other things impacting turnover that even the best health and well-being program can't address. But in theory, it should reduce your turnover rate. It should improve your engagement, and most companies have engagement scores. Every year you'll do an employee engagement survey, and you should see those scores around your engagement improving year on year, and especially those around work-life integration. Does my company support my well-being? All those kind of questions, you should start to see an improvement in those over the years. And what does that do? That improves productivity. If somebody is healthy and well, and they're engaged, and they love working where they work, they're going to give more of themselves, and they're going to be more productive and more effective. And in SSMC, we're a patient-centered organization. Our core value is the needs of the patient come first. And so our motto for our Health and Wellbeing Council is, we take care of you so you can take care of the patient. And I think this is the same in any organization. If we are expecting our frontline staff to greet our clients, our customers, with a smile and with empathy and caring, if they don't feel looked after, they're not going to do that. And your first point of contact with a patient, with a client, with a customer, with anybody, if they're not greeted nicely in the beginning, they'll probably go elsewhere. So you're going to lose business if your staff don't feel looked after. So you can put these kind of points together. I think that it's important to have a well-rounded presentation, a well-rounded approach when you go to your CFO, because although they are very data-driven, and if they were only looking at return on investment, ROI, it would be a very short presentation. You just need one slide to show the ROI. But generally speaking, CFOs have a very broad view of the organization. They're involved with every aspect of the organization. They have to be, in order to put the budgets together, in order to make sure resources are dedicated in the right areas. And so if you have a very strong presentation that covers all aspects of it and shows how it fits into the strategy and the culture of the organization, I think you have a very good shot at it. That's what I would say.
This
but
is so
know
amazing.
Your CFO first.
Everybody's dreaming of having you as the CFO right now, I'm sure. Thank you so much. So here's what I heard. I heard that there needs to be structure when you're presenting something like this. It needs to be tied to KPIs. That's also what I'm hearing. Those KPIs should have something to do with the bottom line at the end of things. Even if you don't have current data, maybe you can have a look at how well-being affects bottom line, and you can work with that from previous research. And it needs to be well-rounded, as you said, and you have to get in touch with your CFO early on in this process to see what they think of this project, to see what the approach is, so that you can approach with that angle. But as you said, it takes a whole village to raise a child and a well-being project. So the entire C-suite needs to have the buy-in probably. So it might be best maybe in that case to start with the one C-level person who's more interested in well-being, I think, than to force other doors maybe in the beginning.
Correct. Yeah.
So
that's
thank you so much.
Melis. You're welcome.
Yeah, maybe there's a Carolyn in every organization.
Inshallah.
That was the perfect ending to our call. I know you're sick. Go after yourself. And I have a newborn. I'll go have a look at him now.
Enjoy.
Thank you so much for having this call with us.
Fun.
See you on site in Dubai.
Thank you
for everybody
Bye.
joining. Bye-bye.
Thank you, everybody.